It's my first Zoom call. Hi, Greg.
Hey.
I have just a few questions here. I have a large paraganglioma tumor lodged in my throat next to my carotid artery, making it difficult to swallow. It was diagnosed about 2 years ago by an MRI. Because of its location, it cannot be removed surgically. I have been offered proton therapy radiation.
Mm-hmm.
I prefer not to have it. Also, I have neuropathy in my feet and calves, causing them to be numb all the time. This began 3 or 4 years ago. So I would appreciate any suggestions you
And
may have.
is there presence of blood sugar issues, diabetes, anything like that?
No, I don't even like sugar. Sugar
Okay.
is not my friend.
So one of the things for the neuropathy that we'd want to do is do some lymphatic work. And do you have swelling or puffiness in the legs, the lower legs at all, or?
Not really. It just started in my middle toe on both sides of my feet, and then over the years, it's just done up to my feet. I don't stumble. I can walk. In fact, walking is good. It's just always numb.
Is there numbness on your thigh, like the top of your thigh or the outer thigh?
No,
You don't have any numbness there.
no, it's just below my knees.
And have you had X-ray or MRI of the low back? Like, do we know what's going on with the low back?
Over the years, I've had lumbar issues, S1.
Yeah, I suspect the feet thing is actually tied to the low back. And, when it's just neuropathy, usually when you look at the lower legs, you can see that the blood vessels in the veins are really super dilated. And so we want to move blood away from the lower limbs and clean up lymphatic issues. But one of the other issues, especially like with the area that you're talking about, can be issues. Boy, I don't know what they got going on there. Issues with the low back, and it could be like a bone on bone, or there's a cartilage that's poking out. And I would say we could still treat the lower legs, but I would treat the low back as well, just to take some pressure off of that. And so things that are antispasmodic, which Robert can run you through, but like things like marjoram, things of that nature. But I would actually even go after the pain. Like there's a blend that I have, the pain relief neuropathic, and it's anti-inflammatory. It does reduce some pain. It's antispasmodic. It's meant to treat things that are emanating from the spine. So you would put it kind of directly on that low back area. If there's areas of discomfort, you would put it on there as well. But I think opening up the low back is going to be somewhat helpful for this. And that compared with still using things that help move the lymph. We could target that with oils, but actually probably one of the best things you could put you could put like the orange heater body tonic on it, or lovage body tonic on it. That would be helpful. But it also probably have you get from the health food store. There's an herb called Goda Cola, and Goda Cola is a very good venous tonic, like a very good vein tonic that you would take internally, that would help move. Basically, it firms up the veins and helps move the blood back up towards the heart and the head. And I think you'll find some relief with that.
Thank you.
Between opening up the low back and getting some of the excess blood out. For all of us, the blood kind of lingers in the limbs anyway. But here, I would say the more that we can take that out, the more that it would open up potentially the nerves to function better in that lower limb, from the knee down. And, instead of trying to figure out which one it is, let's just treat both, basically. And if one seems to be giving you more relief than others, we can go a little bit harder on each one. But this is a good, like, general way to start treatment in both ways. As time goes by, we can augment and increase the aggressive treatment towards those things. But I think there's a good place to start.
Okay.
Let's just see if it brings you some relief at all, basically.
Thank you.
Because, like, sometimes treatment is also even a better way of evaluating. We have things here that are pretty straightforward, but sometimes there's just little variations in anatomy or movement, or there might be something that's compromised that we're not aware of, that this will bring it to the surface.
Okay.
Now,